Okay, so we'll go ahead and get started. Good evening, everyone. I am Mayor Cliff McNeil-Smith, and uh, councilor colleagues joining me. Council colleagues joining me this evening are councilors Barbara Fallett, Terry O'Keefe, Peter Wainwright. You can wave. Scott Garnett, and Sarah Duncan. And Councillor Chad Rintoul does send his regrets for this evening, although he may be able to jump on partway through the meeting. And I'd like to introduce our Chief Administrative Officer, Randy Humble, who's joined the call this evening, and our Executive Assistant, Paula Cully, who helped set up the meeting this evening. Thank you. And I'd like to introduce our guest speakers this evening. Our theme tonight is community well-being. And in a moment, I'll talk about how this town hall came to be this evening. But our four guest speakers tonight are Morgan Shaw, Executive Director of the Sidney Business Improvement Area Society, Constable Paul Mittelsteadt, who is constable with the Sidney North Saanich RCMP detachment, and works in the area of community policing school liaison. And we have Jennifer Van S, which works as a coordinator with the SHOAL Center here in Sidney, and Shawna Walker, Executive Director of Shoreline Medical Society. So thank you all for agreeing to be guest speakers this evening. And we look forward to your presentations and questions and answers that may come from members of the public or our council colleagues after your presentations. How this evening came to be was a number of months ago, council resolved to establish a COVID-19 recovery task force. And we decided that it would be a good thing to invite the leadership from 7 of our prominent community organizations to sit as voting members on the committee. And council established terms of reference with 4 main purposes. And that was to come up with possible actions for recovery and resilience economically for our business community, for our cultural and recreation community, for the residents at large, community resilience. And the 4th purpose was to consider what actions we might take or preparations we might take in anticipation of a second wave or future wave of the COVID pandemic. And of course, we established those terms of reference a number of months ago, and we've seen the pandemic progress as it has over that time. And one of the suggestions that came out of the COVID Recovery Task Force is that we have 1 or more community meetings, community virtual town halls, given this is the way we can meet in these COVID times, and pick themes that would be of interest to the community. And this is our 2nd town hall. And again, the theme tonight is community well-being. And from the guest speakers that I've introduced, you can see that they come from segments of our community that are very active with regards to community well-being, whether it be activities in our community, safety, seniors at the SHOAL Center, or through health through Shoreline Medical Society. So I'd like to just keep the introduction brief this evening and go to our guest speakers and introduce again Morgan Shaw, Executive Director of the Downtown Sidney Business Improvement Area Society. Good evening, Morgan, and we look forward to you providing an update and presentation this evening.
Wonderful, thank you so much. Very happy to provide an update on behalf of our Downtown Sidney businesses, along with the Sidney Events Advisory Group, of which I am the chair. For those of you who aren't aware of the Business Improvement Area, it's a district that stretches from the highway down to the waterfront and over about a block and a half. So that's who I represent when I'm speaking towards downtown Sidney businesses. We've been focusing on getting ready for fall events and winter events. We knew that it would look different than even just in the summer with a change in weather. So Sidney has always been highly regarded for the impeccable events that we put on here. So it was important that we execute these well, with safety, of course, at top of mind. So some updates regarding those events. We've got a Halloween sort of a festival of events happening for Halloween, and that's called Sydney's Halloween Spooktacular. That will be coming up, and it will run for a week from the, it'll go from the 23rd to the 31st of October, and that will include some interactive displays throughout downtown Sydney, going from Mary Winspear Centre down to the waterfront. So there'll be lots of things to wander around in the downtown core and see. We've partnered with Artsy, who will be doing a neat display as well in one of our local businesses. There's drive-in movies that are happening at the Mary Winspear Centre, and then we've got a few different contests happening, which I think will be really fun for the community as well. So the purpose of the event, while we normally do Treat Street, which is very well attended, we couldn't quite take that model this year. So we stretched it out in terms of the timing parameters, and we are really hoping that people will take the opportunity to approach the different elements of the event with safety in mind and at their comfort level. So looking forward to that one. That one kicks off here coming up to the end of October. And then for Christmas, that will be the event that we're focusing on after Halloween. Of course, it's going to look much different than it has in previous years for us here without our parade and whatnot, but we're still going to be focusing again on doing interactive displays throughout the town, encouraging people to do lots of light ups. We'll be doing an interactive map online so that people can go and check those out at their own comfort level and on their own schedule. So nothing's going to be planned at a certain time that they have to be attending an event. It will all be done at your own leisure. We'll be doing some photos with Santa, physically distanced photos with Santa, and some really neat campaigns and contests with that as well. So we're looking forward to that campaign developing, but that's basically where we're at right now. In addition to that, we just launched a Safe Sydney campaign, and that was at the result of, we started putting up signage, then we were putting up decals in stores. So we put it all together, and we were able to come up with this mini campaign, more a public awareness campaign. And that will include, we'll be launching a free commercial delivery program towards the end of the month. So it's not active as of right now, but coming up to the end of the month, we'll be launching a program that will allow for free delivery of commercial products within the local residential areas. So that will be available to all downtown Sydney businesses as well. That's the update from my end. I'm happy to answer any questions.
Morgan, could you perhaps just expand a little bit on the Safe Sydney campaign and the pledge, the system you've set up for businesses and pledges?
Yeah, so we used a couple of models that we saw happening throughout North America here in smaller communities. And we are aware that the province is doing a program as well. So it's to work in conjunction with that, but to put our own Sydney spin on it, I guess. But what essentially the businesses do is they take a pledge saying that they're following the mandates of the province and the CDC and the federal government, and that they've got all of the appropriate safety measures in place. And then they're given a decal that they display in their store window. So as people are venturing through the community, they can feel assured that businesses are putting in that care and that effort to ensure their safety. That program has been picked up by a number of different media sources, and that was sort of the intentions of the program, was that while it's wonderful for our residents, we really want to advertise Sydney as a safe place to visit, to come and to shop and do business. So, yeah. That's
great. So it's great to hear that Halloween will happen in some fashion, and that we're getting creative and having the drive-in movies, and plans are underway for Christmas. Are you able to speak to, I've had some information, but are you able to speak to how Remembrance Day will take place in Sydney this year?
From what I understand, the Mary Winspear Center has taken that on as a project. I haven't got a lot of details on my end, but happy to provide them when I do. But I don't have the specifics at this time.
So the Legion of North Saanich is working with the Mary Winspear Center, and the Mary Winspear Center will be hosting a Remembrance Day ceremony in the Bodine Hall. The provincial limit is 50 people. The Mary Winspear Center has been holding events as those joining the call may be aware this evening for performances, and they can do so in a safe manner. And so it will be primarily for the veterans and others that take part in that ceremony. There won't be a parade this year. There will be a private wreath laying that may be videoed at the cenotaph and outside of the time of 11 o'clock Remembrance Day ceremony. And Mary Winspear is webcasting the ceremony at Bodine Hall live at 11 o'clock on Remembrance Day. So good to see that event is happening in our community as well. I'll open it up to any members of the public or colleagues with any questions of Morgan. I'll turn to Councillor Garnett.
Mr. Mayor, just out of curiosity, perhaps we could provide the information as to where individuals can find the website information for that ceremony.
Sorry, for Remembrance Day?
Yeah.
Yeah, it will be it will be on the Mary Winspear site, and I believe others, including the town, will go ahead and list it when all the details are available. But that's a good point.
Great. Thank you.
So members of the public, I realize you're not necessarily live and some are just joining by audio, but we welcome you to, if you just want to unmute yourself and pose a question or comment to Morgan Shaw, we'll invite that. Okay, hearing none at this time, we'll go to our second speaker this evening. And again, welcome to Constable Paul Mittelsteadt from the Sidney North Saanich RCMP. And the floor is yours, sir, for the next 5 minutes or so.
Well, thank you, Your Worship, and councillors, other speakers, Town of Sidney staff, and members of the public. On behalf of the Sidney RCMP, thank you for having me here tonight. As the new community and school business liaison officer, I just wanted to outline my role for this upcoming fall and beyond. So I have a four-pronged focus right now. I'm focusing on the youth of our community, on the businesses. And when I say businesses, I'm talking more about crime prevention strategies for some of the businesses that are experiencing shoplifting and whatnot. I'm very focused on the schools. And we have a newer concept, which I alluded to in an article that was written a while back. It's called Vancouver Island Community Safety and Wellbeing Working Group. And that's a new group that was formed in response to what we're seeing today with our homeless population, with the overdose crisis, and our at-risk population. So those are the four sort of big pies that I'm working at. So so what I'd like to do is, if I could just approach them quickly, just one at a time.
Oh, sure, please do.
All right, so I'll start with the youth of our community. Right now, I'm working with the John Howard Society out of Victoria on a youth mentorship program. It's for youth that have had some interaction with police, whether it be from a victim standpoint, another family member, or whatnot. Anyways, what we've seen is the benefit of connecting these youth that are at risk with a mentor. And we do a lot of when I say we, it's not myself, but the people that do the recruiting through universities and colleges to get these mentors. And the program's been very successful. So it's something that I've just created, and it's something that I am encouraging other police officers that come across this to use as a tool in their belt in order to help some of these youth that are at risk in our community. Another plan that I have moving forward is there is a group that meets once a month, and they're the Greater Victoria Youth Group. So it's an intelligence gathering meeting where probation officers, other police officers from other police agencies, Crown Council, we all get together, we meet to discuss about some of our more troubled youth and about strategies and ways that we can go about helping them and not incarcerating them. So basically, an example of that would be the restorative justice program, where we seek alternative measures to court resolutions and whatnot. So we're working really hard to help our youth without having them sort of fall into that dangerous cycle of entering our basically our jail system at a young age. As well, moving on from that with the businesses, what we can do is we can identify businesses. Obviously, we're aware of what's going on in the business community. Some businesses are targeted more than others, and each time there is a situation where a business has been targeted for theft or whatnot, we will attend and investigate that. But then my role is to come in even after that and work with business owners, managers and whatnot, and look at ideas and ways to help prevent this from occurring again. So it's a very collaborative approach. It's worked out well. It's been well received, and it's something that we're keeping statistics on now too, saying, you know, we've had so many interactions in so many months. Each time we've talked about this or that, and then we can also list what type of outcomes have come from that, right? So it's not new, but it's something that we're taking a more like a reinvigorated approach to tackling for our business community. We found that with COVID and a lot of the displacement of individuals from Victoria, Sidney was receiving their fair share of some of these individuals, and some of them would engage in this type of activity. Some would not, obviously, but so we did see a bit of an increase over the last little while. So that became more important of a focus for us. Thirdly, schools. Schools are always close to all our hearts. We have 5 schools. I'm in there on a regular basis, just working with the children any way I can. I'm in the community in the mornings and the afternoons, looking at crosswalk safety. Again, just being there for the children to say hi. We do some speed control out at the Cove Elementary. Well, that's in North Saanich, but but we do a lot at Sidney Elementary as well, and of course the middle school and the high school as well. So I'm in there, and I'm talking to the administrators and students on a regular basis. So that's been a lot of fun. And last but not least, and what will be hopefully the future of this position, I'm hoping is something what I've mentioned before, is the Vancouver Island Community Safety and Wellbeing. So we used to talk about crime prevention. Now they've come up with a new slogan, and it's this community safety and wellbeing. So I meet every couple of weeks in downtown Victoria with an eclectic group of individuals. We have healthcare people. We've got people that do SEPTED for a living. There's myself as a police officer there. We have a musician. We've got writers, authors that show up, and it's a collaborative group that comes together to try to put ideas, strategies together in order to move forward with this new way of thinking about there's only so much money out there. There's only so much we can do. So then let's try to make maybe some different decisions with the funding that's out there, and see if we can come up with a better way of tackling some of the challenges that we see in the news just about every day. So it's a brand new group, but I'm excited to be part of it at the ground level, and I hope that whatever comes from this group, I can bring to Sidney and to North Saanich as well. So right now there is not a whole lot to report back, but in the coming weeks and months, I hope to be able to speak on it a lot more and sort of use the benefits of working with these other individuals and applying them to our community. So that's in a nutshell what I'm working on right now. So I'm more than willing to take any questions.
Well, thank you, Constable. Could you perhaps how did that community group get initiated? What was the impetus for it being started?
Well, the first driving factor is what we're seeing on the news all day. What I've found is there's a lot of people that care. A lot of us care out there. A lot of us come with different skill sets, and you know, we see a lot of negativity on TV. And so what drove this group was I contacted a local individual out of Victoria who writes an article and in the paper, in the Times Colonist, once a week, and he often comments on policing community strategies and how the answer is not just one thing, it's everybody working together and getting everybody involved in the community. So I really liked what I heard. So because of what I liked what I heard, and I thought it was very forward thinking, and we all know that doing the same old is not going to get us to where we want to go. I contacted this individual. We met in Sidney for coffee. We had a long chat, and there was all of a sudden other people that were like-minded. And so we, through his coordination, he's able to, through his role and his position, to coordinate other individuals. And we got together 2 weeks ago. It'll be 2 weeks ago tomorrow. And we had our first meeting. And it was really good because everybody got to introduce each other, what passion they bring to this problem, and how can we tackle it coming from many different angles, you know, not just the traditional angles. So that's kind of how it came to be. It had a pretty organic beginning, and yeah, I'm really excited about that because it's something that we haven't seen before. At least I haven't, anyways.
Well, it's great. It's great to have a new initiative, a bit being creative. COVID has certainly challenged us in many ways and pushed us to be more creative in the ways we approach things. So that's a great initiative. Again, I'll open it up and please, any members of the public that if you're muted or only participating by audio, feel free to unmute yourself and pose a question or from colleagues. I'll turn to Gail Hazelhurst. Sure, I think you just want to unmute yourself there, Ms. Hazelhurst.
Hi, can you hear me now?
Yes, good evening.
Hello.
Great. I just had a question about Sidney Neighborhood Watch. If you were doing anything developmentally in that area that you could advise us on?
Absolutely.
Okay.
We're very fortunate in the Sidney area. We have a gentleman, he's an auxiliary constable. His name is Ian Collis. Ian has operates one of the largest block watch groups around, and we are very much so. So if you're interested in starting a block watch group or a group around where you live, I would put you in contact with Ian, and Ian would start that because it's very healthy and it's alive in Sidney. We have a lot of block watch.
Oh, great. And how would I get in touch with them?
I would just get your information and I would pass it on to Ian, and Ian would contact you.
Okay. So how do I send you my information?
Okay, if you were...
How about you send it to admin@sydney.ca and we'll make sure it gets to Constable Mittelsteadt.
Okay.
Okay.
Thank you.
Do I do that now?
No, you just, you're fine. Yep. Just mute yourself and say hello. Huh? Thanks
so much.
Great, thanks for the question. Any other questions or thoughts? Councillor Fallot.
Yeah, thank you very much, Mr. Mayor. Constable Mittelsteadt, I'm interested in the youth program you're connected with John Howard Society. Are you seeing a number of Sidney youth that you're able to direct that, or is it really the greater area?
What we're trying to do is we've identified some youth that we are seeing over and over again, some youth that we feel are at the right age to take part in this program. And what we're doing right now is we're speaking with their families. Often it's a single parent that we're speaking with, and those are the ones that we're trying to connect with them. And there is actually a liaison person with the John Howard Society that will help assist with that. So, and again, it doesn't always have to be a negative reason for them to get involved with the John Howard Society. They just had to have had some dealings with police situations where they could be a victim, they could be a witness to something, or they could just be just in need of a mentor. So the program is going to be as good as I can promote it to my colleagues, and I have them remember that this is an option for some of the youth that we're working with, because this program actually helps with the Vancouver Island Community Safety and Wellbeing program that I'm starting to work with, because what we're doing here is we're getting positive results with these youth while they're still young. Yes. And we're hoping to create youth that will be productive and you know, grow up and just be able to do the things that they would like to do, and maybe make some good decisions along the way, and have somebody to bounce some ideas off of. So, you know, this is going to go a long way to helping the bigger problem that we're dealing with sometimes at the end of the road. Yeah. So
to redirect their energies. What is the average age?
Well, good question.
You're working between what, about 11 and 19?
8 to 16 is what they kind of look for. So anywhere in between there. And again, they recruit the mentors from post-secondary schools, in all kinds of different backgrounds too, which makes it exciting. I've read a lot of testimonials, and I can't help but smile every time I read, because it's just really interesting. People with different backgrounds coming together and providing these opportunities for these kids.
Thank you very much for your explanation, and also for your time. I appreciate that. Thank you.
Very welcome.
Okay, turn to Councillor O'Keefe.
Thank you. I'm just wondering about restorative justice and how well that is being used out this way, if you know.
Good question. Restorative justice is something that existed for quite a while. My experience has been it needs a voice, it needs a constant voice, and it needs someone to help my colleagues and remind them that when dealing with youth in certain situations, restorative justice is a definite way to go. It's an alternative to court resolutions. And so far, to give you exact numbers, I've had in the last 2 months, I've had 2 youth that have been redirected that way. And you know, when I read this situation that they're in, it's a really good alternative measure for them, and everybody's participating. We have, again, an outside colleague that works with us. So once everybody agrees to partaking in the restorative justice process, as a police officer, you take it so far, and then we bring in an outside person that works with this situation, and we try to see it through to the end. So we've had 2 files in the last couple of months, and they've worked out really well.
So sorry, when you say it sort of needs, I can't remember the word but maybe a champion or someone providing a higher profile for that. Do we have that in our community, or is that something that we need more of, do you think?
Well, we have it at the Sidney RCMP with me. I mean, that's my role as a champion, right? So that's my role. And again, what I'll do is I'll speak to my colleagues. I have the luxury of seeing my colleagues, different groups coming through day after day after day. So when I sort of spread my message, I have a captive audience for a short period of time, but a different audience just about every day. And I've found with my experience that they just need a reminder that this is an option, and that there are some real positive results that come from this alternative measures. And again, the only time I've ever seen it not used is when it kind of gets forgotten. So that's my role. My role is not to allow it to be forgotten, and to be a voice for the program. And so, you know, when it's warranted and when it makes a lot of sense, we're gonna go in that direction. And we're seeing that with the courts now too. I mean, the courts really don't want to see the youth drag through the court system as much as they have seen in the past. So I really believe that it's going to be well received on all sort of levels moving forward.
Great, thank you.
You're welcome.
Thank you. Well, it's great to hear of those many initiatives in the community. And seeing no other people wishing to speak, we'll go to Jennifer Van Es, who's with the SHOAL Center here in Sydney. And Jennifer, you have the floor for 5 minutes or so.
Thank you. Thanks for having me be able to speak to you all. I'm speaking from the SHOAL Center, but on behalf of Beacon Community Services. Just to let you guys know what's happening in the center here. Of course, everything is different now because of COVID. All our procedures and policies have changed. And we were happy to welcome our members back into the center in the summer in limited capacity. So we have fitness classes that are running, yoga. We have a few groups coming in, doing some activities. They're all within a bubble and in small groups, and things are going really well. The people that are using the center are very appreciative that we're open and they're back doing their fitness. Of course, we're dealing with the seniors of the community, and they are very passionate about keeping up with their fitness level or keeping involved with the activities that they're in, because they just realize that the benefits of them socially is great, as well as coming and getting the exercise. So we're just happy to be able to open the doors. Masks, of course, are mandatory, and sanitizing stations are all over the center, and we're cleaning all the time. So we look very different than we did in March, but it's going really well. Some of the other things that we are trying to get going for the fall, we're trying to get a flu clinic going, a flu shot clinic. So that is going to depend on the pharmacist, if she's available and if she can get the serum. So we're really working hard on trying to get that for the community. We've had big flu clinics here, and of course they bring in a large number of people. So we're trying to get that here, perhaps on a weekend when we have lots of space and not very many people here, and we can allow for a lot of physical distancing and cleaning, and have that done here safely, and be able to get the people from the town of Sidney in to get their flu shots. And if this is something that we do schedule, we'll have it on our website and on the sign outside the building. Lots of people are coming in asking about it, so we're just telling everybody the same thing. As soon as we know, we'll try and get the word out. We have foot care clinics here. We have low vision clinics. So a lot of things that are helping support people to keep healthy while we're going through COVID, and doing it in a safe way with all the new procedures and protocols in place. We have been, since COVID started, working with the United Way of Lower Mainland, and we've been very active in the Safe Senior Strong Communities program. So this program is when people call BC 211, a senior will call BC 211 looking for some kind of support, whether they need some groceries done, whether they just need a phone call from someone, a reassurance phone call or a check-in phone call. We do daily check-in phone calls, weekly check-in phone calls. We have a lot of volunteers that do these phone calls for us, and they do the grocery shopping. And so we get the people calling in from BC 211 and help the people. Beacon Community Services helps the people on the peninsula, so Sidney and North Saanich. And I think we've bought 750 $100 thrifty smile cards, and since March. And some of them may have been Save On. So we're using Save On and Thrifty Foods. People can call us, they purchase a card, we get volunteers to go out and shop for them. So that's been very helpful and a very popular program here. And it's done through the BC 211, people calling in, they're needing help, and we're reaching out and helping the best we can. Volunteers also call in and they are wanting to help, which is great. We've got a lot of volunteers who have come in through BC 211, and they are doing the grocery shopping or the reassurance phone calls. And we live in a really great community where people are just, we've actually had more volunteers calling to help than people needing help. So that's a really good place to be. The other kind of COVID-friendly services that we have, some of our programs that we did before COVID are still running. Some of them stopped for a little while, like our drive program, where we drive people to their medical appointments. We did stop that when COVID started, but we have since started very slowly back to driving people with a lot of COVID protocol in place. We're not doing as much as we were before, but we're pretty much filling every drive that comes in, every drive request that comes in for a medical appointment. And we have caregiver support groups here, so dementia caregivers and family caregivers support groups that meet here. And advocacy. So if somebody calls and they need help with filling out some forms on the internet, we have advocates that will sit with them, maintain their distance. We have lots of plexiglass up, and we try and help them the best we can. And then the other program that we have is our meal program. It's called More Than Meals. And this is a program that we're in partnership with the United Way of Greater Victoria. And we make 3 meals a week for seniors on the peninsula. So a lot of seniors in Sidney, some in North Saanich, and we deliver them. We have 25 volunteers that come pick up the meals and deliver them to the clients who are requesting the meals. So they get a hot meal and 2 frozen meals every week. And that program is just fabulous. We have about 190 people on our spreadsheet that we deliver meals to. Right now, we usually deliver about 170 meals a week. Some people don't need them every week. And the volunteers that are delivering them have just created a great relationship with the people that they're delivering for. They call them to get their meal orders, they chat with them, they see how they're doing, and that's why the program is called More Than Meals, because it's not just the meals, it's the connection that people are having with other people. And especially with COVID, everyone, especially seniors, are feeling very isolated. So all the supports that we've put in place, we really feel like the connection with the community and the seniors has been really good, and we're very thankful for that. And it just helps us keep kind of a pulse on our community and our seniors, and try to keep connected with them. So I do have a short video clip about the meal program. So it's a program that was, as I said earlier, we're doing it in conjunction with the United Way of Greater Victoria. And the video that they made for the program was made here in Sidney. So they're Beacon volunteers that are in the program, and members of our community that are just enjoying the program, and it just explains the program. So if I could share the screen at this point, I would love to share that video.
Please do.
So Jennifer, you are set up to share, but if there's any issues, I can share it through mine as well. So
okay, I'll try and share it now.
Okay.
Can you guys see it?
Not yet.
It's not looking like, or I have permission to share right now.
Let me try, Jennifer. I'll try it through mine.
Okay.
Can you imagine what it's like to be months in your little apartment? Not able to go out, not able to get what you need.
A lot of them.
Can you see it?
Are they're disabled, or they're blind, or
they have some memory issues, and using the microwave and the oven doesn't work for them anymore.
A lot of the seniors could be down to the tea and toast type of meal.
Having a hot meal brought to their house helps them to be able to continue on in their home for that much longer.
Beacon Community Services was founded in 1974 by volunteers, and to this day it continues to be a volunteer-led organization. What's important to me is that everybody has a chance to live their life as well as they possibly can. And what I like about Beacon is our motto is helping people and improving lives. There's a lot of people that are not seeing other people during the week. And we also know that sometimes we're the only phone call that they have and the only person they're talking to.
I find it pretty rough. But I'm still on top.
The people who are most frail in the community needed this extra support. So I really appreciate the fact that the United Way approached us. We felt that this was a great fit.
Thankfully, we have the support financially through the United Way, and it's just showing them that we care about them. We're seeing them, we hear them, they're living on their own, they may be lonely and isolated, and somebody's reaching out and saying, here's a meal, we care about you. It's more than just a meal program, it's reaching out, and it's maybe a virtual hug through food.
Thank you. Thank you for knowing that it matters, for working to have the donations to fund something like this.
They're very compassionate, very loving, and I love them.
There is disparity that remains for Indigenous people and people of color in this country, and we need to constantly shed light on the fact that we are treated different.
So I think that's about all of the video. Did everybody get to see it? So it's a great program to be part of, and most of the stuff that we're doing here at SHOAL, supporting the community, it's been great to be part of, and I believe that we'll continue to be able to do it for quite some time. I think you're muted, I can't hear you.
Sorry. Thank you, Jennifer. Thank you for sharing the video. It was very moving. And thank you for the broad range of supports that Beacon Community Services, you and your colleagues are providing. It increases community connectedness between people and seniors, which has never been more important in the current pandemic times that we're in. One of your colleagues, Glynis Cavers, who we saw on the video and has joined us this evening, is a member of the COVID Recovery Task Force, and she indicated, and perhaps you could provide an update to this group on the size of the senior membership at SHOAL Center, and I know you stay connected through Tidelines and other ways, but it's quite an organization.
Yeah, so we have about 1,000 members. And with our Tidelines newsletter, we send it out to between 12 and 1,400 people a month. So it's a great way to get news out on what we're doing and to stay connected with people. We get the newsletter out physically as well, and that's actually decreased since COVID, because we would get it out to physicians' offices and lawyers' offices, and none of those people are wanting to take the newsletters. So anybody who wants to be added to the email list, they can just call SHOAL and we would add them and send it out. It's got a lot of information about all the supports and services that we offer and all the programs that we offer here as well.
Well, thank you again for your presentation. Are there anyone with any questions or feedback to Jennifer? I'll turn to David Cowley. Good evening, David.
Good evening. That was really very interesting. I speaking as somebody who's obviously a late middle-aged person, as I think of myself, but I had no idea until I was privileged to join this task force together with Glenys that the range of services that you guys covered. I thought, fine, my wife goes and plays mahjong there once a week, you know, when we're not in COVID days. Applause to you. I mean, really what you guys do is phenomenal. You mentioned you've got lots of volunteers. How is your capacity loading? Do you need, what help do you need? What could you do if you had more of? That kind of question.
Right now, we need volunteers for our meal program, delivering meals. We have volunteers that deliver groceries. We could always use more for that. So they come to SHOAL, they pick up the grocery card, they go get the groceries, and they drop it off at the client's house, always keeping distance, physically distanced. We need medical drivers almost all the time. Before COVID, it was a little bit more predominant. It's a little bit harder right now with medical driving because of the proximity of someone in your vehicle, but we're always looking for drivers, and we have a lot of opportunities. You can go to the website and you can see all the opportunities that we have for volunteering, or call the center and we can chat with you about it. We'd love to chat about that.
Thanks for the feedback and question, and thanks, Jennifer. Did I see another hand there before David? No? Okay, we'll go to our fourth speaker, and I'd like to introduce again Shawna Walker, Executive Director of Shoreline Medical Society. Welcome, Jennifer. Or welcome, Shawna.
Thank you very much. Hi, Mayor and Council and members of the public. Thanks for having me. I guess my role here tonight is to address the question of the most asked question of the month. It's flu season, and how do I get my flu shot, right? For those of you who maybe don't know about Shoreline Medical, just give a real brief introduction. We're a non-profit society that was born 4 years ago with a mandate to attract physicians, to provide doctors to our community, and to help support the running of the Saanich Peninsula Hospital. We started right here on Bevan Avenue with 4 doctors in a small clinic. And today we have 2 clinics, one in Brentwood, an expanded one in Sidney that we were so happy to complete on March the 15th, the day that we closed for COVID. We have a big, beautiful building that is very underutilized right now. And the good news is we have, through COVID, been able to continue with our recruitment. We now have 23 family doctors. Since we started, we provided a doctor to over 4,600 people in the community that didn't have a doctor. And we've managed to replace 3 physicians, preserving a doctor for a further 3,000 people. When we started, we understood there was about 14,500 people in a community that did not have a doctor. That number is ever changing with people moving in, people moving out. So it's hard to keep a track on it, but that's our goal of 14,500. And we were just projecting today that we anticipate meeting that goal within the end of 2021. So we want to thank you as Mayor and Council for your support, because in the early days, it was this council that helped us get over some hurdles in the opening year, and we're very grateful for that. So on to the topic of hand of flu shots. thank you, Jennifer, for what you're doing and trying to open up SHOAL Center. It is a very unusual year. Obviously, by now, most people would have attended or would be attending a regular flu clinic at their doctor's office. For sure, Shoreline always had public flu clinics. This year, we will not be able to do so. In order to provide access to our patients that need to be seen in person and to continue with the mandate of social distancing, what we are doing in both clinics is we have doctors operating 80% on telehealth, and then each day there's a maximum of 2 doctors in Brentwood and 3 doctors in Sidney are able to work and keep the social distancing aspect. So that creates a complication for us being able to do a public clinic. But the good news is I do have options for you. So first of all, Island Health has made a commitment that everyone in BC that needs a flu shot will have one. That means they're continuing to make vaccines available, and the only issue is that we normally would have access to all those vaccines by at least by November for sure, and that isn't possible this year. So what's going to happen is we're going to continue to offer vaccines right the way through January till everybody has had a shot that needs a shot. Here's how it's happening. You probably are aware that pharmacies in our area are offering vaccines. There's 4 of them, the IDA next to us, Shoppers, Save on Foods, and one other that's on a link that I'm going to give you in a moment. What you can do if you're wanting to access is you can call the pharmacies, or you can go to the link that I'm going to give you and be able to download a form. The pharmacies actually recommend that you do download the form in advance before going to the clinic because it saves time. I know the IDA right next to us did over 18 flu shots last week. That's pretty phenomenal. He was going 9 hours a day, and he administered with a friend or with a team member 150 flu shots a day. That's not sustainable. He anticipates he's going to keep up with 80 per day, offering 9-hour days right through until January if necessary. Secondly, is Island Health has committed to doing mass immunization clinics, and it has been a little bit difficult for us to know the details and the time. What I understand is that it's going to happen at Mary Winspear in November. There will be 2 days, and there will be a way to pre-book for those clinics. So what we've done as Shoreline is if you go to shorelinemedical.ca, you'll see that the first thing you'll see is our FAQs, because we are trying to work through a process where we receive over 8,000 phone calls a day. Now, it was always high, but when COVID began, it just went through the roof. And so obviously with everything that we're dealing with in our huge growth, managing COVID, ensuring patient access, and dealing with the demand, it's been challenging. We are committed to fixing that challenge so our patients can actually talk to us. But in the meantime, we've tried to anticipate what people are going to be calling about and put those answers on our website to make it simpler for people. So at the very top of that list is, how can I get a flu shot? If you click on that, you will see the 3 options that I've talked about. A link to the pharmacy website, an explanation of how Shoreline is handling it through this time, and then a link to Island Health /flu that links you through to their updates on these mass immunization clinics. We are committed to, as we learn what's happening, we are updating that site every day. So I would just urge you to keep looking there. If you can't get into a pharmacy, you probably will be able to get into the November clinics at Mary Winspear. If you're a patient at Shoreline, you will be naturally receiving it as you come in and see your doctor. We don't have pre-bookings for it, but we're going to be immunizing all patients as we see them. So that's my update. Is there any questions that I can answer?
Thank you for that great update, Shawna. That's very helpful information for the community. Councillor O'Keefe.
Thank you. Thanks, Paula. I was wondering, will other doctors in the Sidney area also be getting a supply of flu vaccine?
Absolutely.
Okay, so people who do have a family doctor will still have access to vaccine that way as well.
Thank you. That's a very good point. Yes,
okay.
If you have a doctor, that's probably your best bet, is contacting the doctor's office. I know that although the commitment is there to provide vaccines for every person that needs one, it's been slow. We've ordered ours and received less than what we ordered, just that they're trying to keep up with the demand. And that's why I say where normally everyone would be vaccinated in October, it's going to be a longer process this year.
Is it Island Health that manages the distribution of the vaccine and decides how it's going to be allocated, or some other body? Oh,
Yeah.
okay. Thank you.
You're very welcome.
Thank you for the questions. Other questions or feedback? David Cavalier, go ahead.
Yeah, I was very fortunate this last week to get a vaccination at the IDA next to Shoreline on Bevan. Thank you very much.
You're one of those lucky people down the street.
I was number 2 in the line. We got there at 7:45 in the morning, and that was fine. Just as a thought, one thing that did crop our mind as we got the shot was to ask for the little card to prove that you'd had a shot. At the moment, there's not too many people asking, but we could imagine, and if you think back to the H1N1, when those shots, quite often you would then find that some facilities would ask you for proof of vaccination before they would let you in. And I could imagine that the same sort of thing might well occur later on. It might be easier if they were made standard, if you like, or just made available. You could ask somebody to fill out the card while they're filling out the other form, and then you've only got somebody to sign it. Just as a thought.
That's a really good point. And I would also suggest and recommend that you take it upon yourself to let your family doctor know that you have been vaccinated. That's been one of our concerns, is how will we keep track of the patients who we know are vulnerable and need the flu vaccine. So thank you for your comment.
Thank you. I'll turn to any other speakers. And again, for those members of the public that are muted or just on audio, feel free to make yourself live, unmute, and pose a question. Okay, so Councillor O'Keefe.
Yeah, sorry, just one more thing, Paula. Your comment about the cards and tracking who gets flu shots, does that information, is it required to be sent to Island Health? So when pharmacies or doctors' offices do immunizations or vaccinations, are they required to provide that information to Island Health?
So the comment on the card, no, we're not. We keep it in our patient records.
Okay.
And of course, Island Health will have statistics of how many immunizations they've dispersed to each clinic. But we aren't required to report names. As a matter of fact, I don't think that would be appropriate. Is it patient confidentiality, et cetera. But that's why I mentioned it's really your family physician that is helped by knowing that you have received the flu vaccine.
Okay, thank you.
Yeah.
Shawna, I have a question.
Sure.
Does VHA have any strategies for targeting, say, the seniors population for flu vaccines?
Yes, targeting I think their mass immunization clinics are aimed at trying to get as many people as possible access to the flu shots. But I'm not aware of any, like, you mean like communicating and targeting at-risk people?
Yeah, communicating and targeting, but for example, an initiative whereby, people in a senior care facility could receive their flu shots, at the facility, at the seniors' residence that they're living at, or.
Yeah, not this year in COVID. That's why the response is this idea of the immunization clinics has come out of the COVID task force that Island Health is involved in. And that's the way that I understand they've chosen to handle it. It will be done, Mary Winspear, socially distanced, tables set apart, and then there are RNs available to do it. But again, it has been a challenging time in dealing with this and the ever evolving demands and changes. So I know that Save on Foods Memorial Arena has made some advancements for these mass immunization clinics, but we are having trouble finding out what's happening in Sidney.
Okay, well, it's certainly helpful that we have facilities like the Mary Winspear Center and the SHOAL Center, with large areas to be able to hold those sorts of mass immunization events. Glynis Cavers, did you wish to make a comment?
Yeah, just a little update. We've been able to get a pharmacist to come and provide immunizations for all of our assisted living residents who live at SHOAL. And the independent living residents have also been able to have the same pharmacist do it, so that I know that some of our long-term care facilities are able to access some people to do the vaccinations, but it is definitely a little harder this year.
Thanks for that update. So I'll open it up to questions to all four of our guest speakers this evening. If anybody has any comments or questions they want to continue with. David Cavalier.
Thank you, Cliff. I hope I'm not over-commenting this evening. While I'm sitting here, I thought maybe I should have given a comment to Constable Mittelsteadt there after he spoke. I just want you to know that I think what you're doing with youth is really important and maybe not appreciated by those individuals for many years later. I think back to when I was 16, 18, part of an engineering group working on the docks on ships in Liverpool with a very interesting sort of dynamic down there. And I can remember, getting friendly taps on the shoulder and "don't be a problem, lad," all right, from Liverpool cops. Looking back on it, that was a very friendly way of keeping me in line. And 10 years later, you could look back and very much appreciate it. So thank you. It's sometimes not acknowledged at the time, but thank you.
You're very welcome, and thank you for your kind words.
Thank you, David. I'm watching for hands here, or anybody who wishes to speak. Well, thank you especially to our speakers this evening, to Morgan Shaw, Executive Director from the Downtown Sidney BIA, to Constable Paul Mittelsteadt in his role in community policing, Jennifer Van Ness and the great things that Beacon Community Services are doing through the SHOAL Center, and Shawna Walker, very valuable and important information for our community with regards to flu vaccinations this year. Thank you for getting the information that is available, and we know more will be forthcoming as VHA makes those mass clinics available and arranges those clinics. So thank you to all of the speakers. Thank you to the members of the public who joined us this evening. We hope you found this informative. This broadcast is being taped and will be available on the town website. So if you missed part of it this evening, feel free to come back in and it should be posted in the next day or so, or share it with a neighbor or friend that this sort of information is available. And it's been a pleasure to host tonight and be able to bring this group together and have my council colleagues join us. Very helpful for us to hear all this good information for what's happening in our community in these pandemic times. We're making efforts far and above that we've ever done before to stay connected and help those who need supports in our community. And it's very much appreciated, everything that everyone is doing. And lastly, I want to thank staff for arranging and putting together the guest speakers and setting this up electronically for us to connect the way we can tonight. So I'll finish there and bid everyone a good evening and thank you again for everyone for joining us. Have a good evening.
Thank you very much.
Thank you
very much. Good night.
Night.